Hi, I'm Krista.
And I'm Jessie. We're going to discuss sickle cell disease, which is an inherited blood disorder affecting red blood cells and inherited the same way that people get their color of their eyes, skin, and hair. In sickle cell, the red blood cells are misshapen, hard, and sticky. They are unable to carry adequate oxygen to the various parts of the body. They can become stuck in small blood vessels and block the flow of blood and oxygen to organs in the body. Signs and symptoms of sickle cell are episodes of pain, painful swelling of the hands and feet, frequent infections, delayed growth and healing, and vision issues. The main goals of treatment are to relieve pain and prevent infections, eye damage, and strokes. When sickle cells create blockages, they can cause crisis episodes in which severe pain, organ damage, serious infections, or even stroke are all possible. There's no single best treatment for all people with sickle cell. Treatment options are different for each person depending on their symptoms. Treatment can include receiving blood transfusion, receiving IV therapy, which is when fluids are given into a vein, and taking medications to help with pain. Currently, the only other medical treatments available would be a bone marrow or stem cell transplant, but they are very risky and have serious side effects, including death.
All right. You can prevent sickle cell disease, acute problems with sickle cell disease by washing hands. Washing your hands is one of the best ways to help prevent getting an infection. People with sickle cell disease, their family, and other caretakers should wash their hands with soap and clean water many times each day. If you don't have soap and water, you can use gel hand cleaners with alcohol in them. Times to wash your hands are before making food and eating, after using the bathroom, blowing your nose, coughing, or sneezing, shaking hands, touching people or things that can carry germs, such as diapers or a child who has used the toilet, food that is not cooked, raw meat, raw eggs, unwashed vegetables, animals or animal waste, trash, and a sick person. Some food safety, bacteria called salmonella in some foods can be especially harmful. Wash vegetables and fruit well before eating them. Cook meat until it's well done, and the juices should run clear and there should be no pink inside.
Okay, so do not eat raw or undercooked eggs. Raw eggs might be hiding in salad dressing, homemade ice cream, cookie dough, and frosting. Do not eat raw or unpasteurized milk or other dairy products or cheeses. Food should have a label that says they are pasteurized. Avoid reptiles. These carry the salmonella bacteria as well as can cause infection in children and adults. Vaccines are an easy way to prevent many serious infections. Children and adults with sickle cell disease should get all recommended vaccines, including a yearly flu shot. People with sickle cell disease are considered high risk for certain infections and should follow special vaccination recommendations such as Hib, pneumonia vaccines, and meningococcal vaccines.